you're how far out now?
3 weeks out.
Okay. And can you tell us, what was your experience like?
It was more better, as they say, than I thought it would be. Being able to walk the first day and get around the day after, and nothing but improvement from there on out. Being able to just being able to walk without the pain, besides the stiffness from the knee, without the pain, and seeing it get better and better. I was so excited. I was up paddleboarding within 5 days of the surgery.
5 days.
5 days.
Not surgical
Well,
team approved.
6 days maybe, depending on how you look at the week of the calendar. But and it's been nothing but great. Walking is great. I don't walk like I feel like I'm gonna fall down, and it's been good, very good. More pleased than I can imagine.
And how's your motion now? You show us what you can do.
It's really good. I'm getting it almost 100% in. I can pull it in all the way, even with my other leg when I try, and just about all the way out.
Great.
So I'm very happy.
Oh,
Very
good.
pleased. I'm more than happy.
And what sort of activities are you doing now? You were paddleboarding?
Paddleboarding,
5 days?
yeah. Within 3 days, 2 days I was doing stairs. In-house PT said I could do that, carrot tenders. And then I slowly. And I've been riding a stationary bike since day 4.
And when did you give up the cane, crutches, and things like that?
Full disclosure.
According to who? Probably within a day.
Within a day or so?
Yeah.
Okay.
I carried I carried my thing with me just so I wouldn't, if I fell, I had it, keep my wife happy. And the cane, if it was rainy or whatever, but I carried the cane. But I was on the steps, I kept it with me. But besides that,
So just to be clear, we don't want people paddleboarding within 5 days, and we do want you we do want you to use the walker for about
Yeah.
2 to 3 days, and exactly for that reason. It's just all
Yeah.
about safety.
and I did keep it with
Just
me,
about
and it was peer pressure from my brother to do something with him. So that's why the paddleboard. But I did keep the walker with me for a couple days if I was doing anything more than just down the hallway for a minute.
Oh, that's great.
Yeah.
All right. Well, you certainly set new land speed records.
It's amazing.
Doing awesome.
Anybody who I've talked to who's had knee replacement or knows somebody can't believe how quickly I'm coming around on it. And I can't either.
Well, it's also your hard work. You know, this is not done without a lot of motivation, and this is why we also talk about it being a team effort. Patient, us, therapy. You know, it's a big team effort.
Yeah.
But people who are really motivated, I think, can do extremely well with that, and that's what we're after. So this really is the goal of Avatar.
Yeah. And that's it. And at PT, they're excited as much as I am to see how I'm going. And they like it because it's nice to see somebody really do well with it.
Yeah.
Maybe not everybody there does. So they enjoy seeing their work with me, that I'm actually doing the work, and they can see the improvements within a week.
So they were pretty happy with
Yeah,
with
they're
everything
very
you're
happy.
doing. Yeah, that's great.
Yeah.
Now,